Hello, my name is Sarah Metcalf, and I wanted to present to you my findings on weight status and its correlation to maternal morbidities in the United States. So why did I want to look into weight status and maternal morbidities? Well, the percent of maternal complications in the U.S. has increased drastically since 1976. When first discovering this, I looked further into what was going on around that time and how this has changed. I discovered that from 1976 to 1980, 18.8% of non-pregnant women of childbearing age were considered obese. And now that number has almost doubled to 34.4% of non-pregnant women of childbearing age being considered obese. Next, I looked into common morbidities seen in pregnant women. Since the 1990s, gestational diabetes has increased by 42%. Cesarean delivery has increased by 30%, preeclampsia by 14%, pre-existing medical conditions by 20%, and overall morbidity rates by 19%. Additionally, maternal mortality rates have more than doubled since the 1980s. In 1987, pregnancy-related deaths were 7.4 out of 100 live births. And in 2013, that was recorded as over 15 per 100,000 live births. So today, the United States has a maternal morbidity and mortality rate equivalent to that of a third world country, and we are definitely the highest among any developed country in the world. I then broke down some data further into race. So I then wanted to look into those races considered of an unhealthy weight range prior to conception and weight gain during pregnancy. I discovered that unhealthy weight range prior to conception, 59.3% of African Americans were considered in this range, 47.4% of Hispanic women, 47.6% of white women were considered in an unhealthy weight range. Then, 18% of African Americans gained more than 40 pounds during pregnancy, considered a high maternal weight gain. 15% of Hispanic women gained more than 40 pounds, and 22% of Caucasian women gained more than 40 pounds. Out of these races, 35.5% of African American women experienced maternal complications, and 30.2% of Caucasian women experienced maternal complications. Unfortunately, this data was not available for Hispanic women in the data set I was reviewing. However, we can definitely see there is a discrepancy between unhealthy weight range in African American women and maternal complications seen in African American women. Next, I explored the mortality rates of these races. As you can see from this graph, African American women experience maternal mortality at nearly triple the amount of Hispanic or white women. It has been theorized that pre-existing conditions such as obesity and diet-related illnesses could be largely to blame for this increase in maternal mortalities and morbidities. This would make sense when analyzing the data of maternal mortality for African American women and the amount of African American women who are considered of an unhealthy weight prior to conception. They would be more likely to experience diet-related illnesses and have preconception risk factors. So next, who are my stakeholders? Well, all of you are my stakeholders. We need everyone to work together in order to combat this issue. We need to first start with additional research. Research will help solidify any new policies or guidances that need to be set into place at the government level. And then we need states to identify their own priorities and data sets to help modify these policies to fit their individual needs. We need professors and medical schools to get on board with new research and help update their trainings to go along with this research, ultimately improving healthcare professional care and education for this target population. We need to target women 16 to 40 years of age. We need to target minority women, overweight or obese women, and pregnant women in order to start improving the health of this population and getting the policies and guidance in place that we need. This infographic was then developed to help further highlight some of the risk factors and things that this population can do to improve their overall health. So weight status before and during pregnancy. It states right here that you may be at greater risk for maternal comorbidities if you are at a higher weight prior to conception, during pregnancy, or if you gain too much weight during your pregnancy. So next it highlights who's at risk. We need to first target non-pregnant women of childbearing age. If preconception risk factors are really the main culprit, we need to catch childbearing women before they conceive. Additionally, the number of obese women before conception has almost doubled since 1976, as stated earlier. Then the African American population. African American women are not only more likely to experience maternal mortality, maternal complications, but they're also more likely to be overweight and obese prior to conception. Again, helping target these preconception risk factors and of identifying the population most at risk. Then we need to look at women who gain more than 40 pounds during gestation. Gaining more than 40 pounds during pregnancy is considered a high weight gain and can lead to additional complications, not only for the mother, but for the health of the infant as well. It can also hinder the mom from bouncing back as fast prior or after pregnancy, and it can hinder her ability to properly care for her infant after pregnancy as well, and also limit her from being as active as she needs to be during her pregnancy to help not only her health but also the infant's health in the womb. This next goes on to highlight some common complications that can be seen with these risk factors. Conceiving while at a high weight status and or gaining too much weight during pregnancy increases a woman's chance of developing many maternal complications. First, gestational diabetes. Gestational diabetes increases a woman's risk of developing diabetes later in life. It also increases the infant's risk of developing diabetes later in life. It also increases the infant's risk for being large for gestational age, which has its own health implications for both the mother and child. Then preeclampsia. Preeclampsia is high blood pressure that can lead to seizures and strokes, ultimately impacting the health of the mom and baby. This is a serious medical condition that needs to be dealt with right away. And then C-sections and longer, harder labors. A C-section is a very dangerous, invasive procedure that requires additional healing times for mom, and it's harder to adjust for the infant. Longer, harder labors also put more stress on both the mother and the infant, just not giving both a good start to their new lives together. All these complications are serious and can result in death or lifelong complications for both the mother and her child. And then this infographic goes on to highlight ways you can reduce your risks, both before and during pregnancy. So before and during pregnancy, we want to make sure these women are exercising regularly. This will help them maintain a healthy weight before and during pregnancy. We then want to see them eat 5+ servings of fruits and vegetables a day while limiting their consumption of sweets and junk food. This will help the woman not gain too much weight during pregnancy, and it'll also help a woman trying to conceive be at a healthier weight prior to conception, ultimately limiting that risk factor. Then attend regular doctor's appointments. We want to see women attending regular doctor's appointment if they're thinking about getting pregnant or if they're of childbearing age. We want to be able to identify any preconception risk factors right away. We also want pregnant women to attend regular doctor's appointments throughout their pregnancy so that any morbidities that they may develop can be identified and handled right away. Also to stop drinking and smoking. This will improve the overall health of the mother. It will also limit any complications that the fetus may experience due to these substances. And then taking prenatal vitamins regularly before and during pregnancy. We want to make sure both the mom and the infant are receiving the nutrients that they need to support healthy growth and make sure mom's not being deprived of anything during or before pregnancy. And information dissemination. How do I want to present this information now that we have it? First, I believe conference presentations would be a great way to go. There's a lot of conferences such as WIC conferences, pediatric conferences, nutrition conferences that we can present our findings to these valuable stakeholders. We can include webinars. Webinars have become very popular, and I know I get them in my email all the time. To attend these webinars, we can possibly identify some continuing education credits that professionals can get when attending these webinars to help incentivize them to learn more about this issue. Next, posting in journals such as the American Dietetic Association and Obstetric and Gynecology journals. We can post blurbs about the findings. We can post recommendations based off of these findings. We can use both the electronic and paper formats of these journals, have blurbs about the findings sent directly to emails, or utilize it in the magazines that are sent out to these professionals. And then infographic disbursement. We would first update language availability on the infographic to be able to be utilized to multiple language preferences. And then we want to disperse it to sites where preconception care is sought, such as OBGYN offices, emergency rooms, urgent cares, and pediatric offices. Utilizing this infographic is going to hit that target population. It's going to catch the eye of the woman preconception ages 16 to 40, and also the African American population that's most at risk. And it's going to get them to start thinking about some of these risk factors before they conceive, and hopefully while they're pregnant, to help them start leading healthier lifestyles while they're pregnant. Additionally, professionals within these offices that we disperse the infographic to can learn from the infographic and take some of these recommendations to help start educating themselves and their patients to go along with the information that is seen in this infographic. I thank you so much for your time today, and if you have any questions or concerns regarding my findings, I would really be open to answering any questions. Here are some of the resources that I utilized during this presentation. Thank you.